Hello and welcome back to the Osteo and Physio YouTube channel. Today we are going to be talking about carpal tunnel and our top exercises to help with the symptoms. So carpal tunnel is when your median nerve, which is a peripheral nerve as it's exit the neck and move down into the arm, gets compressed around the carpal tunnel here. So it's made up of your flexor retinaculum going over the top as well as your carpal bones here. So it creates like a tunnel around the base of the palm. What happens if we've got any jobs where we're repetitively using the hands or applying any pressure down into this area, over time what can happen is we can start to get symptoms of compression of this nerve. Where it typically presents and how we feel it is tingling and sensation over these three fingers. What we also find is possibly weakness around the thumb and these two fingers, as well as loss of grip strength and pain around the area. So what we want to look at in terms of rehab and exercises is reducing the pressure around here, reducing the pressure down into the hand, as well as looking at mobility through all the attachment sites where this nerve can get compressed. Number one, we want to reduce tension around this area. So a really nice way to do this is to self-massage around into the palm. So we're stretching around this area. So where we've got the hypotheno and thena eminences, we're stretching across these muscles. And we want to reduce the tension around the area. Number two is all about movement around the wrist, movement around the elbow, movement around the shoulder. So we can start by circumducting the hand, so circumducting the wrist, so 5 to 10 circles one way, and then changing direction to go the opposite way. We want to regain movement through the wrist as well as round into the carpal bones. Once we've done that, we want to open and close the hand. So we're opening and closing all of the joints around the hand and then moving up into the elbow. So we want to pronate and supinate. So we're turning in and out through the elbow, so through the radial ulnar joints, as well as bending and extending, so flexing and extending through the elbow. With each of these movements, we want to aim between 5 to 10 reps, so we're opening up through and then again rotating back through the shoulder. So you want to move through the shoulder. So the reason why is when the nerves leave the neck, they're part of the brachial plexus, which then branches off into different nerves, and the one we're looking at is the median nerve, and it can get compressed here, and obviously down into the hand. So if we can get all areas moving and functioning properly without that tightness, we're less likely to aggravate the nerve and fire down into the hand. What we also want to look at is movement into the neck. So again, thinking of all compression sites, so we want to start to rotate very gently through the neck. So again, getting movement through here with each of these 5 to 10 reps, and then looking up and down. So that real nice kind of basic movement through the neck. So ensuring that we're lubricating joints, surfaces, we're moving through, and we're reducing any tightness and stiffness. Number three, we want to stretch around each of the areas that can get really tight and can aggravate the nerve as well. So first of all, we want to stretch down, obviously into the forearm and into the hand. So same as the stretches that we've looked at before, we're stretching through. So these are targeting the flexors and the pronators. We want to hold this between 15 to 30 seconds. And once we've done that, turning and going the opposite way, so through the supinators and extensors, holding between 15 to 30 seconds. So we want to stretch through the pectorals and down into the arm. So again, reducing any tension into that arm. We want to place our hand against something solid, so a fridge or a wall or anything that you can use. Keeping the arm straight, what we're going to do is turn the body away so you feel it stretch across into the front of the chest, and then also turning the neck away to increase that stretch. So that's a really nice stretch down the whole arm, in particular targeting the pectoral muscles. Holding that position there, aiming between 15 to 30 seconds. Lovely, and then relaxing back. And then also where the nerve passes through, they pass through something called the scalene triangle. So we also want to stretch up through here. So yes, we're looking at the wrist of where you're feeling the symptoms, but it's so key to look at all areas where the nerve can get compressed. So we want to stretch through the scalenes. How we do this with the scalenes is we're going to relax the shoulders back. We're going to side bend the neck away from the side that we're stretching. We're going to turn towards and we're going to look up a little bit. We should feel that stretching round the front into here, holding for about 15 to 30 seconds. We can increase the stretch with that side bending if we want to, but again, go within your pain-free range, comfort with the stretching, holding that position. Good, and then very slowly letting the neck relax.